week 4, everybody. While we're just waiting another minute or two, go ahead and start just putting your names and pronouns in the chat, please. Can't believe it's already the end of January,
Happy New Year's are about to expire in like one day.
right?
Hmm.
The week we've all been waiting for, the takeaways and engagement strategies, next steps. All right. I think we can.
One of my minority leadership alum is here. I'm so excited. Hi, Venetia.
Hi, Jasmine.
Hi.
Great to see
Oh my
you.
God. So good to see you.
Give it just one more minute, see how close to last week's total we get for folks, and then we'll get started. All right. How are y'all today as we get ready to close out January? Let's jump right into it. I'm Robin, from, the last few weeks. I'm sure you all know me by now. If you don't, I'm Robin Learned, manager with NASTAD's Drug User Health Team and one of the members of the THRASH working group here at NASTAD. It's the Harm Reduction and Sexual Health work group. And I am joined today by the lovely Jasmine Lopez. I'll let her give a brief introduction for herself.
Thanks so much, Robin. And hi, everyone. My name is Jasmine Lopez Phelan. I use she, her pronouns. I'm coming into this space, well, really excited to be in space with you all, but I have a lot of different hats in my professional life. So I'm going to try to bring in as many perspectives as I can, being a government, worker for a New York City agency, as well as a consultant for a trans-led organization and someone who engages and really supports TTNCMB related research. So yeah, thanks, Robin. Happy to be here.
Mhm. Today we are talking about the takeaways, next steps, and beyond. We're going to review the first couple of the past 3 weeks and have some engagement strategies and how to apply some of those in your own offices and facilities. And if we could jump to slide 4, please, Juan. Go through this real quick. Just we are from NASTAD. I am from NASTAD. Jasmine from New York Public Health. NASTAD is a leading nonpartisan nonprofit association that represents public health officials from all over the country. And we have officials in all 50 states, District of Columbia, Puerto Rico, the Virgin Islands, and several local jurisdictions. And we work to enhance the health and dignity of people living with and impacted by HIV/AIDS, viral hepatitis, and the intersecting epidemics. And next slide, please. Again, our group agreements that we've had in place the last 3 weeks, just to hold space and remember that we're not all here from the same place, but we all are here for the same information. And next slide, please, Juan. So in week 1, we talked about names, using a person's preferred name, using the proper pronouns and why that matters so much. Can anybody in the chat go ahead and just give us maybe a reason why it would be so important to know a person's sexual orientation also as part of our first introductions with them in working with trans and gender diverse folks especially. You just go ahead and throw those in the chat there. And I think for me, the biggest part of week 1 was just stressing how important getting the words right can be for people. Because oftentimes that's going to be the first time they come in. And if they don't feel welcome, if they don't feel accepted from the beginning, they probably won't be back. Yes, Kathleen, exactly. Sensitivity is part of it. Yep, absolutely. And also just on a purely practical level, it informs how we would address different concerns regarding counseling as far as HIV or STI testing. These are all great answers. I love that. And remember, we also talked about the proper collection of SOGI data. And we'll talk a little more about that in the next slide also. But does anybody want to jump on real quick and just maybe give a brief description of how the health of trans and gender diverse people fits into your public health work? How you see it fitting in with what you do?
And also, I'm seeing a lot of great answers here. And since we're talking about, proper collection of SOGI data, that in itself is important to create an affirming environment, right? To be able to, really accurately represent folks' identities when it comes to gender identity and sexual orientation. So I know I'm seeing on the slide too that there's two learning objectives as well, which are to explain the difference between the concepts of sexual orientation and gender identity. So if anyone also wants to take kind of a try at that in the chat, please feel welcome. And, to Robin's point, also feel free to share, how the health of trans and gender diverse people fits into, public health work and, health equity work within your specific organization. But amazing contributions in the chat. We're off to a good start.
Absolutely. So we go on to week 2 then? Yes. Exactly, Africa. That's exactly it. The safe environment is probably the biggest part of making sure that that person is feeling good about coming back to see you again.
Mm-hmm.
Week 2, we talked about, there we go. Sorry. Our objectives were talking about the historical and cultural context of gender diverse people, identifying some of the levels of stigma and discrimination. And we started a discussion about the current state of trans health and safety in the world today. Let's just ask, what was the most surprising thing that you learned in week 2 for anybody?
And no matter how big or small, right? And it can range from anything that you learned from Robin, presenting content. It could be something that someone else said as well, any sort of contribution. At least half of the folks. So Gretchen says that at least half of the folks that they serve at their agency are gender diverse people.
There was nothing in week 2 that surprised anybody? Nice. Thank you, Joan. Yeah,
Transmisia.
that's been a real thing for me recently.
Mm-hmm.
Oh, Danielle, yes,
Yeah.
absolutely. That is a common theme for those of us who have especially worked on Trans Day of Remembrance in the past.
Mm-hmm. Are there any commemorations for Trans Day of Remembrance that are taking place at folks' organizations? Just out of curiosity. Hopefully that was okay to ask.
Yeah, Jennifer, when I first started getting into this work several years ago, that was one of the things that shocked me was the rates of suicide and attempted suicide, suicidal ideation, and the rates of HIV prevalence, especially among trans women of color. Yes. Thank you, Jenny. I'm a big fan of the history. Most any presentation I put together is going to have a little bit about history in it, but especially here, I think it was real important. Some great answers.
Yeah. And the history, provides a lot of important context and helps with the understanding, right, of unique health needs in our community.
Thank you, Jeff. That is,
Thank you, Jeff.
yeah, that is a beautiful answer.
Thank you.
So as we go through some of the rest of this, can anybody list a common way that cis folks can address microaggressions or invalidations that they hear regarding trans folks? Anything you've used before in your own experiences, or anything that you're going to take forward to use, knowing what you know now?
Thank you, Danielle. Yes.
Yes,
We are calling out. Yes. And calling in too.
absolutely. Always speak up. Just like most other things we talk about in the world, it's not necessarily the person being attacked's job to defend themselves as much as it is the people around them to step up and say something.
And also making sure that we speak up, for our community members, both in public and in private as well, even when they're not in the space.
Yeah. Yes, Wendell, that works really well. I have seen that used so many times. It's the best way to make them feel so uncomfortable. All right, great. Let's move on to week 3 then. Next slide, please, Juan. Week 3, we had some objectives of learning ways to create a culture of safety and inclusion, as well as your staff. And we talked about elements of the provisions of gender affirming care, including different levels and ways of transition and how to support an individual's choices. And we talked about the importance of accurate data collection and identifying strategies for improving that. And the biggest reason for the statistics, especially because there is no real overarching numbers for trans health as far as throughout the country, as with HIV, viral hepatitis, or STIs, or even drug use. The last comprehensive survey there was one done in 2015, and there was one done again in 2021, and those results we're still waiting for. They're still finalizing all of those numbers. But even those are just the folks who have the wherewithal to be able to participate in an online survey, right? That doesn't include the folks that didn't hear about it, don't know anything about it, or are too busy just trying to survive and navigate life to even know that there was such a thing. Which is why, like, in the medical office world, it's so important to be able to get those numbers right, because that's about the only place that we see everybody. So what are some ways that you as public health leaders can create a gender affirming workplace, or just fellow staff members? What are some things you can individually do?
And if there aren't, any current, kind of forms of programming or initiatives that exist, what do you all feel can help create, a gender affirming workplace? I know there are some agencies who have, a board around TGNCMB workplace inclusion, policy of respect. Yes.
Absolutely.
Yeah. Absolutely. Thank you, Jeff. Yes, Jennifer. Nipping jokes. Yes. To create that social culture that is affirming. Yes.
Beautiful.
Be a
That's
good
very
model.
commitment. Yeah, being the good model.
Yeah. Sharing pronouns, using them. Yeah. Because everyone has them and everyone uses them. So we want to normalize that.
And yeah, correcting the inaccurate or harmful language whenever it's used. Correct it and move on.
Mm-hmm. And remember creating, a gender affirming workplace also has a positive impact on, the way and the amount of reach, right, that any work that you do with the community has.
So one
And
last
on the
question, just to close the review up. Can anybody explain the difference between or what informed consent model is as far as decision-making medical process?
and does anyone use an informed consent or shared decision making model? And if any of you do, if you don't mind sharing, how that works for your organization.
Exactly, Rebecca. And trusting that the person we're talking to is the best expert on their own life, right?
And being open to having collaborative conversations as well, with that same understanding that people are experts in their own lives.
All right. Good, good. That's a great little review. And if we can jump to slide 10, please, Juan. Our learning objectives for today. Identifying ways of ensuring meaningful representation and engagement of trans and gender diverse people in the services, programming, and policymaking within our own offices, within our own realm. And the second is to increase awareness of relevant resources, trainings, and ongoing support. One of the things I wanted to say in this week, this whole 4-week learning series has been a great introduction to trans folks, trans health, gender diversity, and it is by no means the be all end all expertise on anything. It is more in place to give you an introduction and show you some resources so you can go out and do your own further continued learning and research and build upon the information we've shared with you from here.
And one thing I'll also add, Robin, and to everyone here, I know everyone is sharing really great things in the chat, but if anyone has any questions that haven't been addressed, please feel free to place them in the Q&A function so we can make sure to get to them.
Absolutely, thank you. So today, let's start with talking a little bit about one of those resources. There is actually a best practices guideline out there for trans HIV/AIDS health services. It does, I believe it comes from UCSF, the Center of Excellence for Transgender Health. And with each of these 4 standards is a whole page to a page and a half of some great information on different ways that you can facilitate making these things happen. Things like provider awareness of the specific trans health issues and needs, like we've talked about a few times in just a sexual health or sexual history. are we using proper verbiage as far as asking about partners, right? For instance, asking about people with vaginas or penises instead of men or women. That was, I was kind of amazed at myself even, because that was something I didn't think about until maybe a year into test counseling. And, you know, dealt with it in my own life, but still the awareness didn't dawn until then. Standard 2, client awareness of specific trans health issues and needs. So making our clients aware of specific things that maybe wouldn't affect, you know, cis counterparts or folks that aren't on hormones or in different areas of need. And the third standard of the best practices is incorporating harm reduction into every conversation. And coming from that place of meeting people where they're at, not where we think they should be, and not trying to lead them to where anyone else kind of informs they should be. Sometimes people just want to be met there and left there. And that again goes back to making sure we remember that people are their own best experts. And the standard 4 is having that up-to-date referral and comprehensive resource list that we can always go to and share with our clients so they can go and look the stuff up on their own as well. Is there anything?
And
yeah.
Yeah, thank you, Robin. Right, and thank you so much for sharing these standards with all of us. And, you know, when thinking about these standards, obviously this is a very good, you know, groundwork, right, for the work that you do. But, you know, also think of the different nuances that present themselves when you're trying to operationalize this. So, for example, when we're talking about provider awareness of specific transgender health issues and needs, you know, as a provider, really kind of immerse yourself. Like, what is the health landscape, right? What is the social and political landscape that has an effect, you know, on how you know, engage in care, on how you provide this care to other folks. Kind of learn the different language, you know, that folks within the community that you serve use, so you can be able to mirror that language. And also, as a community member, also, you know, try your best. Although it can be a little bit taxing or emotionally draining, especially if there's like a very difficult social or political climate, but, you know, take a look at the health landscape, take a look at, you know, who are the affirming providers, and, you know, lean on support from your fellow peers, you know, fellow community members, and what are their experiences accessing health services as well. When it comes to harm reduction, you know, that's always kind of the hot topic. We always want to make sure that folks are safe, regardless of, you know, any activity that they want to engage in. But we also want to think of the objective definition of harm reduction, but then also keeping in mind that what we interpret or what we define as harm may not be what someone else, particularly a patient or a community member that we're serving, you know, can see as harm. And when it comes to referrals and comprehensive resource lists, I think there is a plethora of information out there, and we always want to make sure that it is accessible, it's digestible, and it's available in multiple ways. That it's not just found in one place, but in multiple formats that are easily accessible for community members wherever they go.
Absolutely. Great point. I would just add a little thing to that, to standard 2 for our informed consent model to really work well. Our clients really need to be aware of all of the different health issues that go with whatever their specific health needs are, right? And that's it's like not giving it the full amount of information, not sharing all of what we might know isn't the best model for informed consent. Also, really kind of leaves folks with a bad feeling about us as a provider, I think, in a lot of ways. And for standard 3, the biggest thing that I forget to talk about sometimes is in the harm reduction. It's not just substance use that we're talking about. It can also be their use of underground hormones if they haven't been able to get a prescription, or in some cases, silicone injections. There was a time where there were a lot of silicone parties, they called them, where folks could go and get injections all in the same place. And harm reduction there would just be meaning talking to the folks, especially about the risks, about whether making sure that nobody is like sharing equipment, for instance. That has been a hot issue in past years in different places, different times. Maybe not so much today because of the proliferation of harm reduction, but it still happens. And I think we're ready to go on to number 13. Go on to the next one, inclusion and equity. And I'll let you handle that stuff, Jasmine.
Yeah, thanks so much, Robin. So we've been talking a lot of, different practices that we can use to affirm our community members in all of the services that we offer. But something that I want, to ask for the group is how does, if folks want to share in the chat, how do you specifically define equity and inclusion? And what is the context that you use for that definition? I want to give folks just a moment to share in the chat how they define equity and inclusion. And then we can build off, from there. Okay. Yes, absolutely. Thank you, Danielle, for that. That's very important. So also moving away from the idea that needles are just used, right, for substance use, right? Many people in our community use needles for their hormones. They use needles for diabetes medication. They use needles, for any other sort of aftercare potentially. It's good destigmatizing that. Yes, absolutely. Thank you, Lily. Yes, thinking about outreach and engagement. Supplies. And by supplies, you mean swag, kind of the different types of promotional materials and different materials we offer community members, because there is a little bit of a psychology behind that as well, thinking about what will be most effective and beneficial. Africa says equity is providing the resources that are needed by the individual to ensure that they can achieve a positive end result. Absolutely, Africa. Thank you. Amazing. Okay, so you all are thinking on access to information. Yes, absolutely.
Mm-hmm.
And when we're thinking about equity and inclusion, and please feel free to continue to share, but as folks continue to share, think about also what are some milestones that have contributed to your equity and inclusion goals, both as a person, a professional doing this type of work, but then also as an organization, and maybe being part of a team, or just if you're in a space to kind of observe these different milestones or be part of them. So what are some milestones? Right, a safe space with no judgment zone. That's Africa. Mitchell says everyone gets the information and resources they need, right? And treated the same. All gender bathrooms, yes. Thank you, Danielle. And explicit signage, right? That says that, anyone can use the bathroom that, aligns with their gender identity. So really like enforcing that and leaning on, local legislation that helps kind of bottom line that, right? Thank you. Thank you. Amazing. Okay, Jeff is talking about updating paperwork in multiple languages. Yes, language access is a huge part of equity and inclusion.
Absolutely.
Allowing people to access, right, languages that they feel comfortable, with, allows them to talk about their experiences and their needs in the most affirming and accurate and honest way. Absolutely. Awesome. And, to further kind of get into, kind of the nitty gritty of it, um, talking about milestones, also like what programs and services have been implemented in your respective organizations or you specifically have worked on to promote and advance equity and inclusion. So Danielle says inclusion in our electronic medical records here at the Connecticut Children's Hospital. Yes, absolutely. Because we want to make sure that we're also supporting our TGNB young people. I'm actually pleasantly surprised to see that Connecticut, has like a lot of, folks that are like really interested in learning about this work and really increasing their capacity. So usually us New Yorkers, we're like in this equity bubble. So
Gotta say, I
Jennifer
love that
says
Connecticut was
we
the first
added,
to ask for the training.
no, that's amazing, honestly. And Jennifer added, we've added preferred name to our paperwork. Yes, so we use preferred name, chosen name, personal name. Yes, those are all great. Yeah. Angel says to keep learning, which is super important, right? Just that openness to learn about new topics. And, even if you're going to have a little bit of that sort of resistance, to be open to like working through that and really demystifying and picking that apart. And in talking about that, right, and in talking about always learning, are there any growing edges? And by growing edges, just places, areas of improvement, to always increase understanding, can any folks share any growing edges that they see in this work, any improvements that they feel they would like to see in this work, and also how they best, can be addressed both on an individual level and also on a programmatic and system-wide level. Yes, the language changes so much that it is hard to keep up with. Yes, absolutely. It is, but I think that language is something that, is constantly evolving, and our understanding of language is never just kind of native to us. It's something that it's a lifelong process, right? So the way that we spoke or understood things even 5 years ago is very different from, our understanding now. Thank you, Danielle. Anyone else? Yes, speaking about elderly, yes, older PG and CMB folks, absolutely. And TGNC and B, I'll just write it in the chat, Robin, because I know I'm using the acronym a lot.
One of the reasons I just shortened it in this training to gender diverse. Kind of covers all of us.
Yeah.
And one thing about the language change I would say too is just recognizing that that is a cultural thing, not just exclusive to the trans world or gender diverse world. It is something that is generational also.
Absolutely. Robin, it's interesting because sometimes I get a little bit pushback on like pronouns, like, oh, well, why do we need to use pronouns? And, my response is always, well, we've always used, our pronouns in some way, shape, or form. We never really thought, right, about them. But I think the conversation around pronouns is important is because pronouns have been used as both a way to affirm people, but to also not affirm them, to like misgender them. So the act of correction to say, hey, well, actually, I go by she and her, or refer to me by she and her. I think those were like the very beginnings of this conversation, that we now have, and the importance, right, of using pronouns and knowing who, who folks' pronouns are, or what folks' pronouns are, excuse me. In Africa states becoming more relational with care, see the human first and take it from there. Absolutely.
Yeah.
I think, yeah.
Great way to sum up that whole conversation.
Yeah, absolutely. Thank you, Africa. Next slide, please. Is that okay, Robin? Yeah.
Yeah, absolutely.
Yeah. So when thinking also about the work that we do, the way that I approach the work that I do in TGNCMB health, research, and community support, I'm always trying to bridge the divide between the community and said organization, because no matter how much work that we do, there is always room to reach additional people, right? There's always room to create additional partnerships. There's always room to further elevate the work that we do. So in thinking about this, if folks want to share in the chat, how would you describe the relationships that exist? And, think about community partnerships, think about collaborations that you have, with different teams at your organization. Like, have they evolved over time? Are these relationships, kind of long-standing? Kind of, if folks can share about what types of relationships they have and how do they exist? Jenny is asking.
Yes. Yeah, all 4 of the weeks of slides will be sent out probably in the next week or 2 to everyone registered. So you will get all of those. Yes, Jenny.
Awesome. And I'm glad that, hopefully you are feeling better since you're with us today. So glad you're feeling better. No worries. You're welcome.
Do that all the time, Jenny.
Anyone else would like to share about, and it can be one relationship, maybe one particular partnership that they have that really helps with, bridging that divide. And also when I say divide, I don't want folks to take it as like a negative connotation. A divide can mean many things. It can be, differences in opinion. It can be silos that exist, within the work that we do. It can be, a community that we want to reach, but there isn't programmatic capacity at this time, to kind of reach them. So a lot of things can contribute to a divide. And, some divides are more kind of polarizing because of, let's say the right for people to like simply exist, right? That is one divide that, kind of creates a lot of tension. There are lots of forms of divides that exist. And a lot of them can actually be addressed with the right tools. And I guess when thinking about this too, are there any common or like long-standing issues that have been addressed or need to be addressed? Anything that you're seeing in your work, or just kind of when it comes to advancing TGNCMB health equity?
Yeah, well, I've been participating on the Ryan White Part A planning councils, and I even took part in JSI technical assistant through HRSA. I even worked as a consultant to train other planning councils, and it's nationally. It's there's a lack of having representation of the trans community, or on the planning councils, and every planning council that I spoke with or worked with on that project had that issue, and so do we. And then we have had great folk be involved, but they get kind of burnt out because it's so few that we kind of jump. Everybody wants to jump on them and say, "Come to our meeting, come represent here, come represent there." And it was, and it's the same with youth as well. So it's those two populations come to kind of go through the same thing as far as representation and being overburdened when you are the one who's willing to step up.
Thank you, Danielle. That's great conversation point right there. That's what originally got me into a lot of this work, was joining the State Planning Council here in California and looking around and realizing I was not only the only trans person there, but one of the only community members there. Most folks were from other planning councils, right? And the amount of work, I was fortunate to have someone else join a few months later with me, another trans woman who was just as loud and just as open about everything as I am. So it kind of shared the burden between the two of us. But yeah, every planning council, I think, locally throughout the state of California, I've never seen more than maybe one person in that room that is trans or gender diverse.
Absolutely. And I think we're always kind of in this space and trying to negotiate representation and then tokenization, right? Which are, two very different things, but they're super duper prevalent in the work that we do. And then forgive me if I mispronounce your name. Is it Jamie or Jaime? I'm listening, I'm hearing it, I'm seeing it in both English and Spanish. But yes, you're saying that you think the relationship between providers and patients at the clinic, at the work, can be very tenuous. Yes, absolutely. Absolutely. And then you serve as a buffer and educate providers and other caseworkers. Yes. Jamie. Okay, perfect. Jamie. Yes. Right. And that must be pretty difficult sometimes to act as this buffer and also educating, right, other, folks, other community members, staff members, but then also, working to affirm, your own identity as well. Right. Because, when you give education, right, there is a certain degree of representation, right, because people are going to take what you're saying, as a representation of what the community thinks as well, which is good, in many spaces, but we also have to remember that this is just one, it's just one set of experiences. And we have to listen to all of our community members, but also not put them in a situation where they're constantly, right, having to, educate and be a buffer and mitigate and mediate. So thank you for sharing that, Jamie. And then Venetia says, I was just going to say the same thing, being mindful not to tokenize or integrate individuals when we ought to be truly inclusive, right? We don't want to check that box. We don't want to kind of approach it like, oh, you don't have a trans person in here. We gotta get one really quick. Like, definitely not. We don't want to, approach it that way. And we also don't want to pigeonhole, community members into a certain type of work. That's why I was very intentional by coming into the space. Like, I'm not just wearing one hat, I'm wearing multiple hats.
Absolutely, Danielle. This whole national, I don't want to use the word discussion because it's not much of a discussion, but this whole movement right now to protect the kids, as they're calling it, is taking away the autonomy of every one of those individuals who knows who they are, right? How young did all of you know that your gender matched your identity or not, depending on who you are and what your experience is? But by treating it as something of we know better, or you're going to grow out of it, or we need to protect you, it's completely stripping their autonomy and even their respect and their life in a lot of cases, their choices.
Yeah, and they jet too. They will jet away from that person, and it's too bad because the provider, you know, not to knock the provider, but the provider is really just caring, and it's just totally wrong and doesn't even understand how disrespectful they're being. But like things like, are you sure? Like, our kid's not gonna mess with you anymore. You know what I'm saying?
Right.
But you know, although it's coming from that place, you know, it's just they get asked that question probably too much, you know. And like you said, who asked anybody else that? Like, are you sure of your gender? Like, you know what I mean? So
Mhm.
yeah.
Yeah, absolutely. I know, I hear you 100%. And also, you know, I think when we're talking about, you know, making sure to support, you know, our children, our young people, and especially, but really, you know, anyone, you know, who is transgender diverse, you know, we want to make sure that we don't put them in a situation where all of a sudden now they don't have a choice but to kind of go around the system or go against the grain in order to affirm their gender, because that, you know, can put them in very, you know, very unfortunate situations. It can cause a lot of, you know, harm. It can cause them to have to negotiate, you know, different things just, you know, just to be able to affirm their gender, which is still important, but I think it shouldn't have to be as hard as, you know, systems make it. And also on the flip side, thinking about providers, there are providers who are still open, right, to providing, you know, the support services, the gender affirming care, but they're also facing, you know, punishment as well. And, you know, when a community is also down a provider, that also affects the entire community, especially in places that don't have, you know, a lot of healthcare services to begin with. So it really creates like this sort of healthcare desert, you know, as these providers, you know, are, you know, what's the word? You know, there are ramifications, you know, they're like fines, and some of them even, you know, face like prison time. And it's really becoming this kind of epidemic of, you know, kind of hate, and it's just really manifesting in different ways. Um, but thinking about all that too, I guess, and that in itself is, you know, a divide, right? So what do folks need to help bridge the divide in their respective programs, agencies, with the community? What are some things that they feel they need to reach community better? Thank you for sharing, Ruth. And even just acknowledging, right, you know, that, you know, your non-binary child struggles, like that in itself is a form of support. Just knowing that, yeah, this isn't, you know, easy for them, and just being in the know of that allows you, you know, to be supportive, you know,
Mhm.
to them. Yeah.
Go ahead and jump on to the next slide, please. Just to come back around to this from a different angle. We all know representation matters, right? We hear that in so many different contexts, in so many different arenas in public health. One of the simplest ways, are there images on the walls in your clinic of trans folks, of gender non-binary or diverse folks? Do you have specific marketing and educational materials for the community? Things talking about, say, for instance, HIV testing or PrEP or gender affirming care even. Those are two big ways that a trans or gender diverse person can find affirmation and kind of relax a bit more into knowing they'll be treated well in a space without anybody even having to say a word to them, right? If they see that kind of representation, if they see that kind of work happening on other fronts within that agency, they're going to be looking a lot more at, okay, this is a great place for me to come then. Is there any other ways y'all can think of real quick that can demonstrate that safety and inclusion, and besides just outright saying it? You know, kids today, they don't always necessarily believe our words, just like the adults.
Right. And when thinking about this too, yes,
Yes.
non-gender specific groups, yeah.
Oh, cool. We're right on time.
Amazing. Thank you, Jennifer.
Absolutely. Wearing buttons or pins that show you're trans or queer supportive, even if it's just your own pronoun pin, right?
Yeah. Oh, that's nice. That's amazing.
That's nice, Will. I like that.
Yeah. A progressive pride flag hanging outside the building. Okay, Jeff. Thank you. Thank you for that. That is a very bold, yes, that's very bold, but I'm here for it. Yes, absolutely.
And yeah, Lily, that's a great point. Yeah. Not just receiving, but incorporating the feedback we get.
Mm-hmm. Yes, more providers should come out into the communities. Yes.
Absolutely.
Like the concept of being, like for the people, right? You are there, to serve, the community.
Mm-hmm.
And community remembers, who shows up at different community events, who's really out there engaging. Like community remembers, and
Absolutely.
they know who's who in the community for sure.
Yeah. If we can go on to the next slide. Oh, I like that. Stickers, the lanyard, all different. Yes. Swag.
Yes, amazing.
Swag is some of the best ways.
And something I did want to add to this conversation of kind of demonstrating that your space is inclusive and putting up pride flags and stuff like that. Something important to keep in mind with doing stuff like that is ensuring that the space actually is inclusive, because you might be a very understanding and welcoming person. You might be informed on trans issues, but if your boss and coworkers aren't, putting up pride flags and stuff like that might end up being misleading, just because you're telling people this is a welcoming space and then it's not. So just keeping in mind that you make sure that when you, like, these are signs that you're putting up, you're signaling to people that it is safe to come here, that you ensure that those places are indeed safe to come into.
Absolutely.
Great point.
Thank you, Juan. And also, putting in place, internal accountability processes when, when you all, when there is a, kind of this idea that this is a safe space, but then there are still growing edges, right? We want to make sure that, and also like the imagery and the messaging, that we're also not perpetuating stereotypes of the communities that we are, portraying and, kind of representing, via proxy in a way.
Oh, no. Okay. we're having technical issues with videos playing on this one, so I will get the link for that and drop it in the chat, and y'all can take a look at it at your convenience. And with that, we're right at 11 o'clock. Yeah, go ahead and see if you can get it real quick, Juan. Otherwise, we can go ahead and take a 5-minute break. There. I think I've got the URL for everyone too. There you go.
It's really a great video. Like,
It is.
it's an amazing video.
Not hearing them. I don't know what's
Nope,
going
there's no sound. No. That's all right. Go ahead and take 5 minutes, come back at 11:07.
I think when you're sharing, you just have to hit that share audio button and you're playing the embedded YouTube video. So if you stop share and share again, there's a notification in the bottom that says share audio, if that helps.
We also want people to
There we go.
understand that
Should we play it once people get back, since people might have already gone on
Yeah.
break?
Yeah, we'll just
Let's
start
do that.
back with it in about 4 minutes.
Thank you to the person who suggested checking the audio box, because I had not done that.
All right, as we all come back, let's go ahead and play that video.
We also want people to understand that the fight is not over yet. There's a lot to do.
You should be able to come to work and wear one thing one day that's sort of read as one gender, and then come to work the next day and wear something else that's perhaps read as a different gender, right? I should be able to just come to work one day in pants and come to work another day in a skirt, and that shouldn't be seen as inconsistent. That should be seen as me just bringing my full self to the job, because that's what it is. Transgender and gender nonconforming people are now a fundamental part of the fabric of the world around us.
Recently, it was headline news that Facebook moved to give users the option to self-identify amongst dozens of gender options. Why are they doing this? Because that's really where millennials are going. Millennials fully recognize a spectrum of gender identity, gender expression, and sexuality. And those millennials that are going to be filling your ranks in the next couple years have a full expectation that their employers are going to match their values.
Most recent research done by the Human Rights Campaign indicates that out of young people who do not identify as cisgender, 2/3 don't even use the word transgender to describe their identity. They use words like genderqueer, non-binary. Honestly, in a lot of samples, the word unicorn has been listed as statistically significant among responses to gender-based prompts, right? So what that tells you is that the younger generation of the workforce, millennials and folks even younger than millennials, we're bringing a gender revolution into the workplace. We're bringing it with us everywhere we go. It's coming, and it's really important for any organization to be ahead of that curve so that you don't have to lose really incredible, brilliant employees to discrimination or to just not being prepared.
We've found as this work goes on and as more and more people come out in the workplace as transgender, that the difference between a good experience and a great experience is how we bring our policies and practices to life.
Transgender people aren't the only ones transitioning. HR is as well.
Success is when I can use all of my experience and bring it to the table.
Work is also about dignity and identity and purpose.
If we create an environment where people can be happy and be successful, then the whole environment will be successful.
And we've seen change happen in our lifetimes because people met somebody.
You're always going to be dealing with underrepresented populations, but really, this is the forefront of the next wave, especially the millennials that are coming in.
So we have to be inclusive of transgender and gender nonconforming colleagues. We have to learn to embrace the genderqueer and transgender community because that's part of setting norms for everybody.
The way you opened up your mind to allow for greater opportunities for women, for African Americans, for Latinos and Latinas, for disabled individuals, for military veterans, you have to do the same thing for trans and gender nonconforming people.
We need more C-suite leaders talking about the importance of transgender equality.
And what I would hope for the transgender discussion, there'd be much more room and space for everybody to be fully who they are.
Gender, in all actuality, doesn't need to be the barrier that stops us from experiencing anything.
Jeff, I loved that reaction. That's exactly what I was feeling too.
More than just
It
a
was
beautiful dance.
chills,
It's a touch of the divine.
so much of just everything in that one little 2-minute video. And if we can go on to the next slide, please. Now we're going to shift gears just a little bit and a few more little definitions maybe, and a pretty intense discussion for a few minutes about what it means to truly figure our place in movements. And this doesn't just apply to the trans movement, but but it does center on it for this conversation anyway. So when you think about the words allies or accomplices or co-conspirators, what's the first thing that comes into your mind? What do any of those words mean to you? Exactly.
Great answer, Jeff. How we vote. Yeah. Support.
So let's go into, yeah, great answers. I'm loving this. And this is all taken directly from a paper that was written, I want to say a year and a half, 2 years ago. Yes, Jessica, how we stand up for folks. Yes, Jamie, that's exactly at the levels of engagement. We can go on to the next one. We all hear the word ally all the time, right? The thing that really stood out to me in this part of it is an ally is someone who supports equal justice in theory, but also an ally is someone who doesn't necessarily have to do a whole lot to be considered an ally, right? Just voice their support, maybe learn a little bit. Not saying folks don't, but just saying to be defined as an ally. It's maybe looking like memorizing the acronyms and doing the aerobics involved with navigating pronouns, or committing time and energy to ongoing learning and trying to, like, coming to trainings like this, exposing yourself to new ideas and new thoughts that can be completely foreign to some of us. But the part that like hit me was it's often done with thoughts and prayers and sometimes words in smaller group settings, right? And I think the author of this deliberately chose those words and the connotation that would give us in mind, especially as we go into the next two definitions. If we can go on to the next slide, please. Slight difference here, right? An accomplice is someone who's actively working to dismantle those systems. They passed through the allyship, they've learned, they're continuing to learn, and now they're starting to see their own role in upholding some of those systems in the past. Flipping the script and applying what they've learned and helping change that bias throughout the entire system. And I think one of the things that stood out was they begin to tap their privilege in the service of justice, disrupting and interrogating institutional biases, oftentimes without having those specific relationships with colleagues of LGBTQIA experience, or of, you know, the experience of people of color, let's say, or any of the other areas where you would be working to dismantle the structures that be in this world that keep so many of us separated. Yes, Danielle, exactly. Solidarity. And I know there's often been in the past a kind of negative connotation with some of these words, like accomplice, like co-conspirator. They're words used in legal settings historically, and not in such great ways. But in this kind of discussion, for me, this is what we need, is to really dismantle the things. We need people from all parts of it actively working to do their part in it, right? And the next slide goes into that a little more, a co-conspirator. How do we do that? Working alongside the community, right? Looking for and creating meaningful relationships with people that you are actively supporting. And part of that means listening to them, respecting their viewpoints, respecting the work already being done in those spaces. And then using their own privilege to fight and standing up and putting themselves on the line willingly, instead of, asking the trans or gender nonconforming folks to step up and educate some of the others in the office, maybe taking it upon ourselves to do that so that somebody doesn't have to exhaust themselves doing their job and being everybody's teacher, right? I loved this last one, asking how they can show up for the people already doing the work and not trying to come in and suggesting, oh, let's do this and trying to take over the work, as we've seen so many times in the past in different areas. What other things do you think could make someone a co-conspirator or even an accomplice? Yeah. Jennifer, great point right there. Yes. Getting involved. As you go through these, ask yourselves, where do I see myself in this work? Do I see myself as an ally, as a co-conspirator? Absolutely. Great answers in here. Kat, I love that. Challenging the HR policies. And Lily, understanding the meaningful progress requires changes. Absolutely. Remember, the only thing in this world that never changes is the fact that everything changes.
Right. I could not have said it better myself, Robin. That is so true. Yes.
And if we're uncomfortable with change, maybe looking at where that discomfort comes from. Is it the change itself, or is it something else? We as human beings are kind of built to adapt and grow. And for whatever reasons, a lot have come to places where we're so uncomfortable with change. For myself, it took taking a look at why I was uncomfortable with changes to learn that, oh, it was my own thing. Once I worked through a lot of my own traumas and stuff, it was much easier. Now I love change. I thrive on it in a lot of cases. It's exciting. It keeps things interesting.
And I think something about change too, Robin, is that, I think a lot of the time we don't give ourselves like enough grace. And I think that there is a way to, give ourselves grace, give other people grace when, navigating these different changes. And, understanding that it's all a growing process and that change is just a natural and organic thing, that we're not always going to be the same person with the same understanding, and that in itself is it's okay. If you feel that discomfort, that means that something within you is moving, it's shifting, and that is a really good process. And always, assume best intent, but also understand that there is, varying forms of impact, and also that, you can give grace without having to compromise, who you are and what your needs are. So I also want to make that, pretty clear for folks as well when navigating, change.
Mm-hmm. Yes, yes, Rebecca, that's the biggest thing right there. And next slide, please. Just a final thought about the journey that this all takes us on. Moving along that continuum, there will be setbacks, like we were just talking about. Like Jasmine just said, giving yourself that grace. Keep in mind that mistakes are going to happen, and that's okay. Don't let that stop you, right? Keep in mind that, people are working to empower and help liberate. They don't get the choice to opt out. We don't get the choice to not be trans anymore. Just like, people of color don't get the choice to all of a sudden one day wake up and be different. Not that any of them ever would anyway. Absolutely, Africa. Yeah, I love that. I have found change makes it so much happier and so much easier. Sometimes easier, maybe not simple, but does make life better. And always remember to nurture your own cultural humility. Learn from your mistakes and keep showing up. And the biggest one I loved in this whole this whole thing that she wrote was just remembering that when you are called in on something, it's a sacred gift someone is giving you. It's not an attack. Don't take it personal. It's somebody who believes in and cares enough for you that they want to hold you accountable so that you can do better, so that your capacity can increase. And you're never going to get past your growing edges if no one tells you when you're slipping up, right? We see that in so much of life. Just that last line sums it all up. Be gracious, learn as you go, and keep showing up. Give yourself the same grace you would give to others.
Something I also want to add, Robin, too, for all of us is that, I know in the first slide, you asked, or we asked, right, do you want to be an ally, a co-conspirator, or an accomplice? But really, you don't have to choose between either of those, because I think all of the different ways that we show up in the work that we do, we pull, right? We show up as a co-conspirator, as an ally, as an accomplice. In my own work myself, being from the community, I always try to make sure that I'm engaging in all of those with my own community, making sure that I do find ways for, programming to happen. I find different ways to bring in, the folks of my community advisory board to, share their knowledge in other spaces, to be able to collaborate with other teams, at like my health department, for example, or, at Trans Latinx Network. It's really just like an all-encompassing process. Like, I know a lot of times, people say, oh, well, allyship is something that you do, but it's not something that you do. It's also part of who you are and who you really become. It becomes part of that personal evolution of really seeing other people's humanity. And, and just acknowledging that they also have a right to exist, and they have a right to love, respect, and, the pursuit of happiness.
Absolutely. And if you can go to slide 23, please, Juan. The next, yeah, there we go. I'll let you start that conversation, Jasmine.
Yeah, thank you, Robin. And I know I was talking a little bit, utopian and kind of nebulous a little bit, but, I do love to lean into the abstract, because I think that creativity allows us to do a lot of work, but in concrete ways where we can demonstrate allyship, being a co-conspirator, and An accomplice is very concrete ways, just by listening. And I'm calling this operationalizing listening to the community. So making sure that you're hearing community is a very important thing, because it has a very direct and positive effect on the programs that you include, that you create, and the reach that you do to community. Needs assessments are a really great tool to use to be able to listen to community in various ways. Work on leveraging your partnerships with providers at different community-based organizations. Really have these kind of deep conversations with them and ask, hey, what is community, coming to you with? What are some concerns that are coming up? What are, some gaps in your programming that maybe you, as a bigger organization or as an organization that's positioned differently in society, how can you help them? Reaching out to individual community members, just listening to their feedback, and just asking pointed questions. If you're, out in the community at a community event, if you're tabling, really don't just talk about your services that you provide, but say, hey, is there something in these services that we offer that you actually would like to see? What are some things that would, help, community members like you further engage, right, with our services? And, that is a part and a demonstration of allyship, of being a co-conspirator and an accomplice, being able to find different ways, right, to kind of work through bureaucracy, and also use cognitive interviewing as a tool. Cognitive interviewing is a really important tool when we want to measure the way that information is reaching our community, our community members understanding, the information that we're trying to provide, the services that we're providing. Do they think that they're relevant, beneficial? Is this information or are these programs structured in a way that makes sense, right? In a way that doesn't feel prohibitive or doesn't create additional barriers, to folks. You can also go very hyper local. By hyper local, I mean zip code to zip code, because you'll be surprised at how many differences, exist from one zip code to the other, even if they're right next to each other. So really kind of see what is going on from zip code to zip code, how much community representation, are in these zip codes, is there a sort of community support desert in them? So really, kind of looking for all of these different ways, right? Community groups, focus groups, town halls are a lot bigger ways to be able to reach community, but they are very effective. In New York City, many years ago, we hosted a series of, trans economic empowerment forums, right? Where, we went, borough to borough, and reached the TGNCMB community there and, asked them about a variety of topics. We created breakout groups where, folks who had an affinity or a particular interest in a topic and maybe wanted to have a stake in it. So really just creating all of these different opportunities to not only collect community feedback, but also to really just show the community that you're listening and that it's also a two-way street, that you are engaging in an actual, meaningful dialogue. Thinking about, compensation, right? Having varied forms of compensation. Sometimes there could be immediate compensation, deferred compensation for, the work. And kind of think about that. I tend to do deferred compensation in my work just because it allows me to give a larger sum of compensation all at once. And it allows me to also mitigate any financial, right, or fiscal climate changes. So that's me all just trying to work within these systems. Just really, and when you go into this, just think about what information you're looking to gather, and also, making sure that any information or any feedback that you gather all contributes to that greater good, which is to always address an unmet need. Next slide, please. So again, at the state level, making sure you are hosting, different listening sessions, but not just listening, but again, engaging in that, meaningful dialogue, having this in multiple locations. As I mentioned before, we went from borough to borough. late afternoon and evening hours, accommodate a lot of the schedules, of our community, whether, regardless of the type of work that they're engaging in, again, having focus groups, for different community members to also create, these little affinity spaces for folks. And also really be intentional about asking and inviting community participation into the creation of campaign and advertising materials. Because if there are materials that are created by and for the community will respond well to that. They will see that, their fellow community members are inviting them to these programs and to these services. It creates that camaraderie among our community. And it allows for allyship and folks being co-conspirators, and accomplices to also exist within and also outside our communities. So it's all like working in tandem. Next slide, please.
I would just add with that, that little thing about making sure we're having it at different times to accommodate different schedules, right? Making sure it's different compensation levels for different amounts of involvement. And finding community champions that can help us get the word out about some of these things and maybe lead some of these conversations for us also. Next slide one. There we go.
And as we continue to talk about, this topic, we also want to think of always, meaningful engagement. Ask yourself, in respect to your own organization and your own work, do you have a planning group? Do you have a community advisory board? How many LGBTQI folks are currently on it? What does the representation look like? How many opportunities are there for, continued participation, repeat participation? How do you select, the folks that are part of the board? Also, if folks, ask if you need support in creating, these spaces, who can you lean on? Who can be your accomplices, your co-conspirators, your allies within this work? So lean on your fellow colleagues and your peers. Think about what focused recruitment looks like. Different community members, are going to have different needs. Different pockets of community members will have different needs depending on what it is that you're trying to get out there in the community. So think of, focused recruitment. Think about how many listening sessions and focus groups, for example, you'll need or you've already had. And what has been the progress, between having all of them? We want to make sure that we're not meeting just to meet, right? We're not just kind of bringing people into the space just to say that we brought them to the table, right? We always want to be intentional about every move that we make. And something that I would also want to encourage folks is, at your own respective organizations, identify any specific work that's already being done, around TGN-CMB health, LGBTQ health, or just community support in general, which encompasses a variety of things, legal services, food security services, anything. There is so much that falls into community support. But, to kind of collapse it a little bit, think of, 2 to 3 opportunities for collaboration, try to identify at least 1 to 2 programs, that maybe can benefit from additional collaboration. There are many ways that, we can leverage all of our experience, because even folks who are resistant to change, they have experience, they have knowledge. It's just a matter of getting them to a place where they feel comfortable to share that knowledge and incorporate it into equity work, and especially this type of equity work.
Right.
And I guess to help facilitate that, what I would like to encourage folks is, in the chat, if you can share at least one concrete step that you believe you can take or you would like to take, to support TGN-CMB folks in regards to, health and community support equity.
While you're putting those in the chat, I'll just go a minute into as someone who joined a community planning body for the state of California several years ago, I had never been to a either Ryan White Part A or Part B planning body at a local level, at a county level, I jumped right in at going to my first state meeting, and I was very, very blessed that California had a few folks in place that came along that listened to us and heard me and the other trans person that I had brought to the table with me. And they went out and hired a trans health manager for the state. They went out and actively worked to facilitate bringing more trans people into the planning body. And that's a word that you will need to keep in mind when you're recruiting folks from the community to come and join your planning bodies. Sometimes they've never been on any kind of HIV planning body or any kind of group like this before. They might need a little help with like facilitating getting them there, or maybe they don't work in the HIV world like so many others on those planning groups do. So if they're not getting paid to be there, how are we making it easier for them to be there? All things that need to be considered as you're going out to actively recruit and bring folks in. How can we facilitate making that easier for them so that they want to participate? Oh, I love
Absolutely.
that, Lily. That's
Thanks, Rob.
awesome. Thank you for sharing that. Yes. Those of you who are sitting on planning groups, whether local or state, how can you think of anything that you could do yourself to help recruit trans or gender diverse voices to those bodies? Do you know of any of those community champions you could maybe talk to? Do you have any colleagues in Connecticut that may be trans or gender diverse that you could also go to for support or for conversation? Right? Simple little steps like that sometimes can have the biggest impacts. All right, Jill, we're almost there. Now try to leave a few minutes at the end today for some questions because we, have had such great program all the way through that we haven't had time for questions much at all the last few weeks. Great, Africa. Yes, absolutely. That's the
That's a
best.
really good idea.
Yeah, that's one of the best ways of recruiting other like-minded folks. Reminds me of the old what was it, Breck hair shampoo commercials? I told a friend and she told two friends and she told two friends. Next slide, please, Juan. Now we'll go into that thing you've all been wanting to know about. That thing they keep talking about that's there underneath everything, the trans agenda. Will that video play it all, Juan, or not? If not, that's okay. We can go on with it. There we go.
This is a movement rooted in joy. Do you believe in the power of trans lives?
Black trans women must be trusted to lead.
We demand a world where trans people are never forced to leave our homes, where indigenous cultural practices, land and body sovereignty are respected.
We envision a world where all trans people are affirmed from the moment of their birth.
A world where the healthcare we need is readily available.
All trans people deserve a long and fulfilling life.
Trans people deserve the freedom to thrive. We demand a world without cages.
These pillars are just the beginning of our demands. We invite you to do more than just ask what you can do for trans lives. Act and join us by signing on to the Trans Agenda for Liberation.
Let's be real. Life can get tough, to say the least.
No matter how many times I see that, it gives me chills every single time. Next slide, please. Quick tour. I love that. No. Yes. So this was actually created a few years ago. It's being recognized and put out by the the Transgender Law Center. And it's all about migrant justice, disability justice, racial justice, environmental justice, reproductive justice, economic justice, and gender justice. I love the last line though. It's an agenda for trans liberation, but it's a blueprint for liberation for all of us. Right? One of the biggest mottos we had at the place I used to work was, if we can serve the most underserved well, then everyone above is going to be served well also. And for us, it was all about building that programming in that way specifically. And let's jump into
So I can go. Oh, go ahead, Robin. Sorry.
No, go ahead. What were you going to say?
Oh, no, I was going to start with the pillar, but
yeah, go ahead.
I can have you. Yeah. So, so there are a few pillars, you know, that are included in this liberation, you know, philosophy, this vision. And pillar one really is to make sure that Black trans women and femmes are leading and living fiercely. You know, we want to make sure that we always trust them to lead. Black trans women always should be trusted to lead. As we know, you know, Black trans women are disproportionately impacted by violence. You know, we see this every single year, you know, with the amount of, you know, violent hate crimes, and also just instances of fatal violence toward our community. You know, Black trans women definitely receive the brunt of that. And also, you know, they're just disproportionately impacted by healthcare disparities in just, and in so many other areas. So we always want to make sure that we trust them to lead. Black trans feminine people hold the expertise and the solutions to end violence in our communities. And, you know, and I'll include myself as an Afro-Latina woman, you know, we hold the knowledge to create a world where Black trans feminine people have the freedom to thrive. And we envision a world where Black trans folks have equitable access to healthcare, housing, bodily autonomy, especially like just trying to control our bodies, please and thank you, and intergenerational connection.
Thank you. Next slide. Beloved home. The vision for the second pillar is a place where trans people belong. It's demanding a movement that honors Native American, Alaskan Native, Native Hawaiian, Pacific Islander, Asian, Indigenous, Black, and migrant trans and gender nonconforming, non-binary, and two-spirit peoples, but also centering their leadership, right? Indigenous or migrants, we understand that our relationship to this land that is our home is as important as our relationship to ourselves and each other. And part of that vision is honoring and respecting that for all. It's a demand for a world where Indigenous cultural practices, land and body sovereignty are respected, and where trans people are never forced to leave their homes. And that is a thing that has gone on in this country for many, many years. And next slide, please. Go ahead and take that one, Jasmine.
Sure. So pillar 3 includes intergenerational connection and lifelong care. So we want to make sure that our communities are only as strong as our relationships and care for trans people of every age, so young and older. We envision a world where all trans people are affirmed from the moment of their birth and are empowered as their authentic selves at home, at school, in public life, and really just life in general. All trans people deserve a long and fulfilling life, and we are building a movement that values the beauty of youth and elder wisdom and understands that aging is nothing to be feared.
Absolutely. And next slide. Pillar 4, defining ourselves. The vision is our bodies are our own. It's autonomy. We demand a world where the healthcare we need is readily available, where our bodies, our status, our disabilities, and our viral loads are no longer policed or criminalized. A world where everyone, disabled folks, deaf folks, sick folks, and mad people are guaranteed complete self-determination and resources, right? To live our fullest and best lives. And it's the freedom to define ourselves and our futures, free of any procedures or gatekeeping or extraneous things put on us by others outside of our experience. I think is the best way I can put that one. And then pillar 5. The freedom to thrive. That's really what it's all about, isn't it? Deserving that freedom to thrive. It starts with a world without cages, a world where people in sex work economies have rights and protections, where sex work is not used as a justification for violence or harm, a world where there is no such thing as walking while trans, as it's been called in so many different cities. We demand not only freedom, but active community support in building lives for ourselves and our families on our terms, not the terms society wants to give us as a whole. Next slide. I just loved this graphic. I had to make sure it got in there for y'all to see. We embody the movement. We feed ourselves to feed our liberation. And that extends all the way up. Like as we help liberate the trans and gender diverse and gender nonconforming among us, we help liberate everyone else as well. And we can, from there, go to about 5 minutes of any questions that y'all might have over the course of the whole thing, or of this one specifically. Anything anybody wanted to bring up in those last few minutes? No, y'all, we did that good. You don't have a single question? That's a good question, Wendell. Yeah. I believe we're going to be sending out the recordings. And then with that, we could send the slides as a PDF. Absolutely. And yes, please share within your agency. If anybody wanted to talk about setting up trainings for their agencies, I'd be more than willing to talk to you about how that, how I could best support you in providing your group with that training if you wanted to do that. Think of this more as a train the trainer kind of exercise if that helps for you also, if you feel comfortable with that. And personally, I feel like the more it gets shared out, the better it's going to be for all of us in the long run. But that's just speaking for myself.
Thank you, Joan. Yes, and thank you so much for being here.
Absolutely. Thank you for coming along on this journey with us. When you get this, especially this last fourth deck, but every deck will have sources, references, and materials for further study. Like I said a little while ago, think of this as your introduction to all things trans. And from here, you will have a lot of resources that you can go and continue the education yourselves and further yourself along that journey of going from ally to accomplice and co-conspirator.
Robin, if it's okay, I'm gonna add my different forms of contact information just in case anyone has any like health related questions, or community support questions. So I'll just share
Absolutely.
my various emails at different organizations. So depending on how folks want to reach out to me.
As we get ready to just close it out, I just want to put out a special thank you to all of my amazing and brilliant co-presenters. It has truly been an honor having you, Jasmine, and Tiffany, and Zoe, and Billy, and Sharday coming along and just helping inform this whole conversation.
Absolutely. And thank you so much, Robin, for the opportunity. It was amazing to work with you, and I hope that we can continue to work together.
Yes, me too. And yes, Juan, thank you so much. It wouldn't have been possible without your expertise in the back, taking care of all things technical.
Bye, Jasmine. It's great seeing you.
Great seeing you too. Thank you.
Thank you so much.
We'll talk soon.
All right, talk to you later. Bye.
Bye.
Thanks, Robin. Thanks, everyone.
Thank you all for being here too. This has been amazing.